In Australia, over 1.5 million people suffer from sleep disorders, more than 1 million from sleep apnea. Their treatments have become a big industry. Many people find they don't sleep well most nights, and often without energy during the day. How often do you hear people say, "Oh, I didn't get enough sleep. Oh, if I can only get more sleep." Can I strongly suggest that it's the quality of sleep that's important? And even if these people had 10 hours sleep every night, they would be a little better. However, we've all heard the expressions, "Oh, last night I slept like a baby." Yeah? I slept like a log, meaning still, deep and restful. I slept like a baby. Little babies don't snore. If they do, they're an extreme exception. We all started life like that. So what happens? What causes this gradual decline in quality of sleep? Well, since snoring is just noisy breathing while asleep, and sleep apnea is about stopping breathing while we sleep, then clearly it's all about breathing. You know you can get better yourself, naturally. How? By understanding and simply correcting the real cause of the problem. I'm Brian Firth. I've taught over 6,000 people full-time for 10 years how to retrain the way their body has come to breathe and to dramatically improve the quality of their sleep, reducing their need for symptomatic treatments such as CPAP machines and medications, and training them how to correct the real cause. So what causes this gradual decline resulting in poor sleep, apnea, snoring, daytime fatigue, nasal sinus problems, panic attacks, even asthma? All people with these problems do not breathe correctly. Their breathing has come gradually and permanently to breathe incorrectly. No exceptions. We all know that just like when some people overeat, their body puts on weight gradually, and permanently. And we say they become overweight until they do something significant to change this. When people overbreathe, such as mouth breathing at rest while walking, sitting, sleeping, being busy, stressed, anxiety, then the mechanism that controls your breathing changes gradually and permanently. Just like our fitness changes, our eyesight changes, our blood pressure changes gradually. And when the breathing gets around 3 times what is normal, problems occur. But most people don't realise. During the day when their mouth comes open from time to time, they just don't notice they don't think anything wrong. It could be like this. But when we lie down, this increases the breathing further, and often when we go to sleep, we breathe the way our bodies come to breathe over all these years, and for many people their mouth comes open to accommodate this incorrect heavy breathing. The heavy rate of breathing causes a noise, which we call snoring. People don't start life snoring. It's a gradual thing that happens as our breathing has changed. Now, breathing is all about getting oxygen to your whole body. So when we don't breathe correctly, the oxygen to our body drops. So our body then tries to stop us breathing like this by sucking the walls of the airway shut, sleep apnea, or blocking noses and nasal passages, hay fever, or for some people squeezing the bronchial tubes, which is asthma. But when we go to the doctors, all these conditions are treated separately and symptomatically only. Drugs for nasal and asthma problems, sometimes even surgery. For sleep, it's sleep studies and then CPAP masks and machines on your face for the rest of your life while we sleep. These treatments attempt to reduce the symptoms of the problem only, like a painkiller. Now, symptomatic treatments can help. We all need a bit of painkiller now and then. But we never get better. And the more we use, the more dependence. So here's what you should know. You can change the way your body breathes. What I offer is something called a breathing retraining course. It's been around in Australia for 24 years, takes about 4 to 5 consecutive days, and teaches you how to correct the all-the-time automatic breathing mechanism so that which at rest is gentle, nasal and pretty quiet, day or night, awake or asleep. Now, when people do this course, usually their life is transformed. I'm serious, within days you'll be sleeping better, waking refreshed with no dry mouth. Within days, sleeping, breathing through your nose. No need for studies, usually no need for CPAP. Over 60% reduction within days, and if asthmatic, on the path of zero asthma, with little application for the rest of your life. Hey, it's not a miracle. You need to apply and learn some special, gentle breathing exercise, a fair bit of education, and you need to learn it properly, but it's not difficult. Take action yourself. I'm Brian Firth. I've taught over 6,000 people full-time for 10 years. I'm based in Brisbane. My main practice are courses in Brisbane, Southeast Queensland, Perth and Canberra, and anywhere via Skype. Treat the cause, not just the symptoms.